Hi, welcome, Richard. We're very
Yeah,
lucky and privileged to have you today as the interim executive director of the S.E.A.S.Centre to share some of your experiences with us. So, welcome, Richard.
thank you, Alan. Thank you for the invitation.
Yeah, so I know that C Center provides a variety of services to many community members. Maybe you can let us know who are the communities you serve and what types of services you provide.
Well, we serve anyone, regardless of their age, their ethnicity, or their self-identification. So anyone who comes in, they are welcome. Uh, that having said, we actually focus on three main community groups. They are the Chinese community, the Southeast Asian community, and the Filipino community. We are multi-services, but we group and have two main branch of services. One would be the family service, and for family service, we focus mainly on domestic violence prevention and crisis intervention. In addition, we do a lot of family life education that aims to promote family harmony and to improve personal growth. And for our other branch of service, we call it the community wellness program. So under the community wellness, we aim to promote uh, or to enhance individual well-being, be it improving their life skills or physical health or mental health. At the same time, we connect them to the broader community by providing them with different volunteering opportunities with C-Center or with other community members. We also encourage them to participate in community events, uh, which organized by SEAS or through SEAS partnership with other community members. And we also do a lot of community networking with other agencies and institutions. So that's basically our services. Uh, all our services are conducted through our four service stage or four branch offices. We have an office at Regent Park. We have an office in North York, which is in the Don Mills and Steeles, at the Don Mills and Steeles intersection. We have an office in Scarborough at the Midland and Finch intersection, and we have an office at the city of Markham. So basically, through these four offices, we serve the GTA population.
Mhm. Yeah, so I know like originally SEAS is kind of like a acronym for Southeast Asian, right? But it's expanded to the broader concept of supporting and enhancing access now to broader population. Um, So, how have you seen the pandemic impacting on the different communities that you serve, and what responsive ways that you've changed your service provision uh, since the pandemic?
Since the pandemic, I think regardless of who we serve, they encounter more or less the same challenges related to their mental health because they are now being isolated or because they are living in a crowded situation, or it could be related to their financial situation because a lot of them have lost their jobs. Despite they may get served, but still it's not the same. And the most importantly, I see it's that impacted them is their accessibility to services. Now that because of the pandemic, a lot of agencies have closed their doors for in-person services. So a lot of them have to rely on um, online programs. which they would have accessibility issues because of their financial constraints. They may not be able to afford the monthly Wi-Fi fees or the technology devices that are necessary. Um, Even if they do, they may not have the knowledge of how of using these technologies. So to me, that's the main issues, and this is basically what we focus our efforts on. Um, in order for this to be achieved, well, basically what we did at the beginning of the pandemics, and something which we still continue to do, is to make assurance phone calls. We attempted to call each and every one of our service users just to make sure they are doing okay. And more importantly, we want to hear from them on what on the challenges they are facing. So based on what they have told us, we have done some activities, to the best of our capacity. We have been distributing PPEs. We have been distributing food, hampers, and grocery carts. We have been giving out um, technology devices. And in this connection, we have been organizing educational sessions, teaching people how to properly use the PPE, how people can properly use the technology devices. Um, and on top of all these, we're improvising. I admit we're still improvising. We are trying our best. We're still trying to learn how to do better online and how to connect to people who cannot, reach us online. So what should we do? We can just say, sorry, we have to do something. And we have to do something maybe in some people's eyes, it should be, wow, it's funny, right? But we have to set up drop points where people can drop off their documents, where somehow we can connect to the persons through maybe volunteers during the, bringing us their documents, bringing us their papers or whatever. So, and it's cumbersome, but it worked to a certain degree that we meet the urgent needs uh, of those people. Sometimes when people say, okay, this can wait, but for us, we say, no, we want to do it right away if possible, because it's all connected to their mental health. We can just imagine a senior person, they receive a letter they don't understand, and they are really anxious. You have to somehow
Yeah, definitely.
read the letters and call them, tell them what it's all about. Yeah.
Yeah, so it's yeah. So I think I had also sometimes need to be more flexible, right? Because people bring in letters from housing or from other things
Yeah.
that they don't understand, and they, don't have. They can't wait for another appointment with another community worker, So even though it's not my job, I still, would explain it to them, right? Because otherwise, that will affect their mental health, definitely. Yeah. So
Yeah.
I really appreciate how flexible and responsive you folks have been trying to really stay close to the community's pulses and meet their needs. How have you find the delivery of group programming online for people? Like I know you have like language classes, you have exercise, you have social stuff going on, right? Uh, are people, you know, besides the technological limitation that you mentioned before, like, do you feel that people are able to continue to build online communities as effective as in-person programming?
Well, there's certainly our challenges, but it's something I think we all have to adapt to. Uh, So let's say for online, we go beyond using like just not just Zoom, uh, but we try to use other social media, which may be more convenient for some of our clientele groups. For example, we are utilizing like WeChat for Chinese community users. They may find using WeChat more accessible because of its ability to adapt to the Chinese language. Or we can use WhatsApp. Um, so it may not be as ideal. But still, we're using different platforms and they are proving it's workable. Um, and then we are thinking about doing group sessions. It's still in the planning process. We are thinking, hey, maybe can we set up a digital hub for uh, people who cannot afford to access programs online at home. So maybe we need a large space where a few people can attend at the same time, or we can develop individual stations with all the safety measures in place. But it's a planning stage. We're not there yet, but it's something we hope we could achieve. Um, be this resolved, probably the biggest challenge would be funding. So we will be asking for, we're applying for fundings to this effect, but at the same time, we cannot just sit and wait. So we have been doing a little bit of online fundraising because since we cannot do anything in person, we have done some online funding activities. And the main purpose of all these fundraising activities is to fill the service gaps. It's imminent that we have to do this, but we don't have the money, but we just can't wait. So that's one way of we hope we could resolve
Mm-hmm. Yeah, I have
getting to
some
achieve. Yeah.
information about the S.E.A.S.Centre's online fundraising activities, like at the charitable fundraising
Yes.
concerts that you've been holding, which I thought was really innovative. It seems to also really help the board and staff and community members come together as well, right? Can you tell us a little bit more of how that came about and how that's been working?
It's um I I I must say, we it's had they were quite successful in terms of it's really a team effort. It's involves staff, board members, and even service users because they will be volunteers helping us to promote. And then we also have professionals from the outside uh, who were willing to give us at a very low cost to have these events implemented. Um, and we, of course, we managed to raise some money. We hope we can do more, and we will do more. Uh, but in terms of the community spirit that is there, and it would it would also lead us to other ideas. So basically, the two events were um, performances, what we call pledged performances or pledged speeches. But we can always expand and have other means in doing online fundraising. This is something we plan to do.
Hmm. That's great. Yeah, so now we're like a whole year into the pandemic, and now there is some, hopefully some light at the end of the tunnel, and we're seeing like vaccines being developed and rolled out to the community. um, what do you see as the emerging needs and changing issues that we should begin to plan and support our communities to work on?
The emergent needs, the first and foremost at this moment, we are focusing on educating the public about vaccination, whether it's safe to take the to be vaccinated, um, giving them information on how, where, and when they could have it done. But unfortunately, we still have limited information. Things appear to be um, still changing every day.
Mm-hmm.
Uh, so, so what we have been doing is when we are calling our service users, we basically give them the information that this is happening, and we're trying to group them. So we have a database on how many people within certain age group that maybe we can help. If there's anything we can do in terms of grouping together, grouping them together to assess the vaccination. Um, at the same time, we already started some online information sessions. We invited medical professionals to talk about uh, what exactly are these vaccines and are they good to your body and should they take it, yes or no, and why. And we also are connecting to like the Toronto Public Health. So we hope they can also help us to give information to our public uh, on exactly when and how they can have the vaccines and is it safe to do so. Um, so this is I would say the most emergent needs that we are trying to address. And then further down the road, we are trying to improve our knowledge and our facilities in doing virtual programs and doing online services. We are still learning on the fly. I always admit, we are not perfect. There's still a lot of for us to improve and to learn uh,
Mm-hmm.
from our community partners because I have seen FPDs from other agencies. They are doing really a good job. For those we would call and say, hey, how do you do this? How can you give us a hand and something like that? Yeah.
Mm-hmm. I think we're all learning together and we're all trying to do the best we can as we faced all these new challenges. And um, so
Yeah.
maybe like you could maybe, I know you're very humble, but can you maybe share a little bit of the thought, like with all these different things going on in the last year, what do you think, as a whole, our different community partners or government partners have done well in terms of addressing the needs of the pandemic, and which are some of the areas that you think we need to work on more and draw more attention on to do better?
I think first and foremost, we really appreciate um, some of the some of our community leaders like the United Way, Okasi, and the different ministries, the from the federal levels and the municipal levels and provincial levels. They have organized a lot of information sessions, which are very useful for us in developing our policies and services. They also keep us informed on where we can get funding support. And these, it's something we really, really appreciate for what they have done. And then further down the road, we hope on the community level, we all community agencies can improve our partnership. We have been trying to work together, but still, because everything is online, we rarely have a chance to see each other in person. Although they are regular online networking meetings, but it's different. Uh, I hope the gradual reopening will help us to work more closer together. And like like Alan, I hope we can do something together, just in terms of doing the vaccination education and actual taking people there, or how we can make the whole process more efficient. Yeah.
Mm-hmm. Yeah, definitely. I think like I do appreciate all the technological adaptations that uh, everybody's tried to have made to address the needs of the restricted ways that we can work and connect with each other. But it doesn't really replace all the in-person connection, right? So I really do hope that we can have a chance to work closer together and certainly coordinate more amongst ourselves.
Yeah, I
um,
think it's very important. Although we're facing the pandemic, the COVID, but it's not just COVID.
mhm.
Whatever community needs that existed before the COVID, they are still here. All the needs are still
Yeah.
here. The things that we have been doing, we still have to do it,
Mhm.
regardless of the COVID situation.
Yeah,
And I
yeah.
really appreciate the our community partners. So just lately, my colleagues and I, we are still we are still planning some community partnerships on, let's say, I think we are going to have an election within the next 2 to 6 months. So
Mm.
we already, our partnership are starting to educate the public on these issues, and we are also doing a lot of community development projects. Those have not been stopped. So my colleagues and the colleagues from other agencies, we are still. I'm happy that we are still uh,
Mhm.
engaging on all these initiatives.
Yeah.
We haven't forgotten these initiatives despite of the COVID.
Mhm. Yeah, so I think despite the physical distancing restriction, it shouldn't prevent us from connecting and working together. And I think it actually
Um,
speaks to more the need for us to really keep closer contact and collaborate. Before I forget though, like I realized that you mentioned that your online fundraising concerts and activities, and also like some of the online information sessions that you've provided, are they available online for other people who've missed out on those activities to access through YouTube
yes,
or something?
yes, of course. Yes, yes, they are. For those who haven't seen it, would like to see it, or those who want to see it again. All these videos are available at our website, www.seascentre.org, www.seascentre.org, or at our YouTube channel. So S.E.A.S. YouTube channel. You will be able to relive all these events, and hopefully you appreciate what we have done and will be generous enough to make a donation. You can go to our website. We have a donation button, and it will connect you to our Canada Health donation station, or you can use Facebook, PayPal. Just search for Seas, and you will be
Hmm.
able to make a donation.
That's great. Yeah. So the links are shown in the video, and then I hope that people can share all those information and support each other as best as we can. So thank you very much, Richard, for sharing your experiences and time with us.
Thank you so much, Alan, for the invitation.
Great to work with you. Looking
Thank you.
forward.